Good morning. Hello, everybody. Good morning. We are obviously starting very late today. Thanks for enduring the weather to get here. This is our 5th annual Food Safety Summit. My name is Michael Schaefer. I'm the Director of Environmental Public Health with Harris County Public Health. I had a whole lot I was going to say, but I'm going to cut some of it out so we can get ourselves back on schedule. Safety first. There are 8 emergency exits around this room, so please look to the nearest one around you. Also, restrooms, there's on the back of your program. On this program guide, if you haven't looked at this, you want to look at this, okay? It has the breakout sessions, everything else. I'm going to go through a lot more of this later after we have some opening remarks. The other thing is if you could please silence your devices, especially when you get to the breakout sessions. A lot of us forget to do that, so if you could do that for me, please. So I'd like to start by asking, whose first time is it here? I always like to get, wow, that's quite a few. I think you're going to enjoy this. I came up with this idea in 2015, actually about a year before that. I actually wanted to share knowledge to the folks that we regulate, because we're not here just to regulate, we are here to educate, okay? And then we have surveys, and we used to bribe you to fill them out because we wouldn't give you a parking ticket, right? But we actually do read those surveys. And the survey said, we would like to see more industry leaders speak. And that's exactly what we did. So I think this will be different than the years we've had before. Deanna and I get the privilege of going to other conferences, and we bring some of that talent to this summit, so I think you're going to enjoy that. And just to give you an idea, when we started in 2015, we had 135 people that started. Today, the weather is making a little bit of a hard day for us, but we had 725 people actually sign up for this event, but I couldn't have planned to have it on a better day. So with that said, I am going to go directly. I want to introduce to you our Executive Director and Local Health Authority, Dr. Amer Shah.
Good morning. All right, thank you, Michael, for that wonderful introduction. I hope everybody's doing well. Really? I hope everybody's doing well. All right, much better, much better. All right, so let me start by saying for those who may not know that there is a month of Ramadan, of fasting for a lot of folks in our community. And I know your restaurants during the daytime were probably not full because a lot of folks were fasting. For those who are celebrating Eid, for our Muslim neighbors, happy Eid to you, whether it was yesterday or today. I wanted to start by saying that. And I also wanted to say that I think those folks are now going to be back in your restaurants to actually start eating again. So that's a good news, right? Good for business? Yeah? Yeah? Okay, good. So I want to start by thanking again Michael and the Environmental Public Health team that have, as well as an incredible amount of people at our department that have done a fantastic job of really leading this effort. And as you see around the room, despite the fact that there's about 25,000 inches of rain out there, you've got a lot of people that have shown up, and we have an almost packed room, which in the next hour or so, by the time we get through the morning session, we're anticipating this whole room is going to be full. And so really want to thank all of you for all the efforts to be here, but also want to thank our Harris County Public Health staff for an incredible amount of work to get you all here. So I want to just acknowledge them. This is a nationally recognized food safety summit. It is a summit that is, unbeknownst to others around the world and really around the country, very unique to what we're trying to accomplish here in Harris County. And it's really important for us to all be thinking about what are the real challenges that we have in food safety. And we know that we're looking at food and looking at restaurants, looking at food establishments, we're oftentimes thinking about the health and well-being of our community. All of you are our practitioners, our partners, our community members. You are part of the Harris County community, and we really want to be a part of the work together so that we're in partnership on how business can work together to really improve the health and safety of our community. And that's what this setting is really all about. And I really want to, again, say that it is important for us to think about food safety, but as we think about food safety, we have to first start to think about our community as a whole. And there is a real opportunity for us to be thinking about innovation for really that future of health. And so I'm going to shift a bit to, how many folks were here last year? Let me ask that question. Okay, so you guys can just go to sleep for about 5 minutes. Just, because some of this is gonna be repetition. And what I'm going to do is really have an opportunity here to describe a little bit of the landscape about Harris County and public health in general. And what that is going to be is really an opportunity for us to be thinking about, oh look, Dr. David Dijak from the National Environmental Health Association in the house. You guys can't leave before 3 o'clock because he's going to be speaking at 3 o'clock, so make sure you're here for that, so we're excited to have him here. But I'm going to give you a landscape about Harris County and also about public health, and that's going to really dovetail into what is food safety and what all of you can do to work with us to really improve the health and well-being and the safety and security of our community. So first of all, Harris County is big, diverse, and complex. Everybody knows that? Yeah? 4.7 million people, third largest county in the US. If we were a state, we would rank by population between Kentucky and Oregon, number 25 or 26 in the country. We're spread over the size of Rhode Island. And when it's one thing to say that we have a lot of people and it's large and diverse and big, but it's also incredibly diverse. We have over 145 languages. We're home to 80, 90 consulates, and you know the international travel that happens between the medical center, the port, the airports that happen in our community. And what that means for all of us is that there are an incredible amount of ethnic restaurants and the opportunity to have people from diverse communities that are going to be dining in your establishment. And we recognize the absolute importance of being the most diverse community in the country as we look at what is really Harris County and why it's so important. But at the same time, we have to think about what is public health. So as a doc, as a physician, whenever people think about health, they think about what? Doctors, nurses, hospitals, emergency departments, ambulances, sirens, right? TV shows, right? That's what people think about. But they don't think about public health. And so if the healthcare system is the quarterback, we are the offensive line of the football team. If we don't do our job well, whether it's Ebola, Zika, or all sorts of other diseases, or it's food safety, or working on measles, at the end of the day, our community, the healthcare system, that quarterback is not able to stay upright. And so that's what public health is all about. And so what you naturally may be asking is, what does a public health department like ours, Harris County Public Health, do in a community? And so let me show you a video to just show that.
Death. That is now a breeding ground for mosquitoes.
75 violations.
Measles are extremely contagious.
So as you can see, public health very much is about the fabric of all these incredible challenges that we have in our community. And oftentimes when we think about those behind the scenes, you don't think about that offensive line. And we really believe that we're part of building a healthy community. And so when you're thinking about all of the different things that come on the news or food establishment inspectors that show up, right, our environmental public health inspectors that come to your doors. Just remember that we're really trying to ensure the health and well-being of our community, including in large-scale emergencies, certainly such as Hurricane Harvey, which all of us obviously experienced 2 years ago. Our road to health, by the way, it's hurricane season. Did anybody know that? It's hurricane season. It was raining outside. Did I mention that? 24,000 inches of rain? Okay. So that was for Dr. Dijak since he just arrived. He didn't know if it was going to rain in Houston. We thought we would give him a surprise. So our road to health is very much about these three cornerstone values. Health to us is really this intersection of innovation, engagement, and equity. We really believe strongly that our department is forging the road for health equity, but really utilizing innovation and making sure that we're engaging our community. And when we look at that, I want to talk about this concept of really high tech and high touch. High tech from that standpoint of innovation, what we really like to say from apps to traps, to high touch and all the different activities. So we know that it's not just about the e-world, it's about what do you do with that. Does everybody have a phone right now? Okay, look at your phone for a sec. Do you love your phone? All right, don't tell me which phone it is. There are some companies you may not like right now, right? But you love your phone not just because of what it does and what it is in front of you. You love it because it connects you with someone, right? It allows you to do something. And that connection is absolutely critical. And we believe that our real concept of apps to traps is really about everything that we at the department are doing. And so Michael and our deputy director who leads our innovation work, Les Becker, who you're going to actually see a little bit later in a video, really will talk about this real concept of innovation. And so we have this app that I hope you will download, Harris County Public Health. You can actually go on that app and look at all the food establishments that we inspect on a yearly basis, and you can see what those inspection scores were over the last few years and really be able to look at how things are happening there in that real overall global way of looking at food inspections. But it's also about mosquitoes, and it's also about emergencies and really connecting with people bidirectionally. So please download that app from either the Google Play or from the Apple Store. Then we also have video directly observed therapy for TB. So this is really kind of cool, working with a group out of Johns Hopkins University that really, when we go out 5 days a week, 6 days a week to make sure people who have tuberculosis, they get their medication, so it keeps all of us protected. Well, instead of just assuring that, because people are on for about 1.5 years on these meds, instead of assuring that by going out there in Houston traffic, we now are doing it by technology, and we've saved a lot of dollars in the meantime, but also provided better population and really customer care to that patient. And finally, the last one here is really this innovation, being the first health department in the country to work with Microsoft Research to have these smart traps with Dr. DeBon in our mosquito vector control division. And these are smart traps that with infrared technology, basically with the individual wing flap of the individual mosquito, can decide if it's the Zika mosquito or the West Nile virus mosquito, capture it, and then on the back end give you data analytics that we've never had before. And that's so exciting and cool. But as you know, again, it's not just about the technology, it's what the technology can do. And for us, it's really about how do you engage, and not just engage on this social platform and in the media, et cetera, which you've seen. We're very active in the media, we're active in social media. I'm on Twitter. Should I mention? Anybody, Shah MD, follow me? Okay, Deanna's following me. Thank you. I got one staff member following me in a room of 500 and Dr. Dijak. All right, I got 2 people. So Shah MD, but also follow HCPHTX, our Harris County Public Health website, and also Harris County Public Health Twitter feed and Facebook and Instagram and all our social media aspects, because we want people to really connect with us bidirectionally, because it's really about high touch. Gatherings like this, and you see this picture from a food safety summit from last year, but really thinking about all the opportunities that we're in the community and doing all the things that we can do so that we can have a healthy, vibrant community, including as we do that in a more mobile setting. After Hurricane Harvey, you saw that on the video, and when our community was not mobile, we had to be mobile for our community, and we had an opportunity to really use these RV units that we had invested in over the years and really get an opportunity to get out there in the community and have mobile health villages, again, in community places where people could not be there. So it's very exciting, and you see images of this excitement and people dancing. Fortunately, you don't have the picture of me dancing, and I do mean fortunately. No, seriously, fortunately, you don't have a picture of me dancing. All right, that obviously did not, I tried 3 times that joke, did not go over well at all. All right, anybody want coffee? Do we have coffee in the back? We gotta make sure we got. So at the end of the day, it's really about bringing it all together, because we have really this real opportunity to think about what is the future of public health. We believe strongly we're not building public health of yesterday or today, but public health of tomorrow. What does the future hold for us? And let me show you this video about something that we have launched recently called Public Health Innovation Lab. And here it comes.
A lot of people think public health and they think traditional safety net services and clinical and immunizations and TB. And while all those things are very important, when you think about public health the next and how can you do it differently and how can you do it in a new generation and a new set of environments with technology and other things, I think public health is how can you really mold your interventions that are traditional and based on evidence, along with technology, along with doing things differently, and customize it to the people that you're serving.
Being able to go out there and reframe the story of health is what 1115 allowed us to do. Phi Lab was birthed out of the success of the 1115 waiver projects, able to then take 77% of the dollars and reinvest them into innovative new projects for the health department that are going to move us forward into Public Health 3.0 and not move us backwards into Public Health 1.0.
Phi Lab was created to precisely address healthcare challenges and remove obstacles and barriers in an innovative way so that we could better reach to the community. We accomplished this by supporting, developing, and accelerating research-driven concepts and innovations into new initiatives.
The idea for Phi Labs really came from the fact that the waiver was designed to transform the community. And in that waiver, they give you what's called an incentive payment. The incentive payment is to continue the work in the community to really change the narrative about what health is. And so when we looked at what we were going to accumulate with those incentives for dollars, we said, how can we best transform the community and then use the concepts that were used during Disrupt to perform with metrics, to use data on how you do it, and to rethink how public health is delivered to those great ideas. You put those two things together and you have Phi Labs.
Phi Lab stands for Public Health Innovations Lab, and it is a collaborative space, but it's also an accelerator program.
The goal of an accelerator is to help an early stage company do roughly 2 years of business building in just a few months. Accelerator programs usually have a set time frame in which individual companies spend anywhere from a few weeks to a few months, working with a group of mentors to build out their business and avoid problems along the way. Companies are given a small seed investment and access to a larger purpose-driven mentor network. A typical accelerator has shared space in a co-working environment and some connection to the local community. In a nutshell, accelerators offer a great opportunity to help young companies and ideas progress in the right direction.
I like the idea of taking from startup accelerators and something that's for profit, but applying it to public health practice.
We do this through education, mentorship, and financing. This is the first accelerator in the state of Texas that's solely focused on public health. Ultimately, our hope is to enable public health practitioners to benefit from the several tools that Phi Lab provides in collaboration with its innovation partners to design and create the public health of tomorrow.
The value of Phi Labs is the ability to multiply a small investment into a really big gain. If you look at things that were done in the Disrupt world, like VDOT, where we took traditional direct observation therapy and turned it on its head and made it video-based, made it less resource constrained, made it more convenient for the constituent or the citizen that's out in the public, Phi Labs will bring that thing to multiple other areas.
And Public Health Innovation Lab gives us this opportunity to figure out how do we cross all of these sectors and how do we make sure that we are addressing the social, the financial, and the health concerns and outcomes of all these communities.
Learning how to think differently, how to embrace technology, how to engage community members in ways that they haven't done before. You take all those things together, which what we know our employees have, which is passion, and you put that out into the community, and good things are really going to happen.
We see PhiLab as a platform that allows people to come together with a common aim to make a difference in the world of public health. Our mission is to bring a social impact at the grassroots level, ultimately serving those in need to make this world a better place so people live a healthier and joyful lives.
Wow. What do you think? A real opportunity for us to change the game when it comes to health in our community. And so you heard of, and you saw Les Becker, as well as Will Hudson and others who were really describing what is PhiLab. I'm just going to show you that Healthy Aging, Senior Advantage are one of the three projects we have. Childhood Asthma Self-Management, One Breath at a Time. Again, we're working with partners on these too. So you're saying, well, what does this have to do with me? And here's that third project, Food Donations Program, Take Out Hunger. How many of you have heard of this program? Okay, so by the end of today, all of you will be raising your hand, right? Unless you're not listening right now. So if you're not listening, then you won't hear. So Take Out Hunger, why waste food when you can donate that food? And so we're really asking you to work with our environmental folks, our food inspector folks, to really, this innovative program that really tailors what you all have, which is extra food at the end of a day, perhaps, or end of a few days, to be able to actually give that to those in the community that have need. And this is really about food insecurity and how do we really think about hunger in our community in a way that's very different. And we've taken this challenge on of food insecurity, as you can imagine. And how many of you have heard of the term food insecurity? Okay, how many of you think that you haven't heard of the term, but you think that you might be able to play a role in food insecurity, even though you haven't heard of what it means? A lot more hands, actually. Amazing. So here, let me tell you a little bit about it. It's really about reliable access to sufficient, affordable, nutritious food, not just good in quantity or quality, but really good in both. And that's really what we're trying to do. And so you may be surprised. I mean, we have a big community, but Harris County, there are 780,000 people that are really with food insecurity in our community. And more than a quarter of those, or about a quarter of those, are children. And so they do not have access to reliable, sufficient, affordable, and nutritious food on an everyday basis. And so what this allows you to do is to really donate wholesome food from your restaurant, and instead of going into a landfill or going in somewhere else, that it actually goes to the mouths of people that actually need it. And that is really something we're going to talk more about in a breakout session, A Future Without Food Waste, from 10:45 this morning in Wisteria 2. So please look out for that. It is something that we really believe is a game changer in our community, has a potential for really changing food insecurity and hunger in our community for so many people that unfortunately are still living with this challenge each and every day. So Food Safety Summit 19, it's our opportunity to really get the word out about why it's important for the private sector, all of you, to work with us, public sector, why we can do this together for the health and well-being of our community. I do want to recognize that we've got an incredible amount of different sessions. We have a panel that's about to come up, digital health, talking about e-communications, health equity, foodborne illnesses, all sorts of things around violations and things of that nature. We're also going to have Judge Lina Hidalgo, who's going to be speaking at noon, and she's going to give us an opportunity to really give our new county judge, elected official, an opportunity for her perspectives on really the importance of food safety, but also working with all of you. So with that, I want to say thank you for being here. Welcome. Have a great day. The room is going to get full. You're going to have great speakers, and let me invite Michael Schaefer back up to the stage. Thank you all.
All right, thank you, Dr. Shah. So I'm going to, again, try to get us on track here. So I want everybody to get out their phones. Okay, just grab your phones. All right, so there's a lot of you that were not here last year. So we do a lot with a program called Slido. So when you go to your breakout sessions, you can ask questions. We also have polls. So instead of giving you the survey that we do at the end of the summit, we're going to take it as it goes. So when you leave a breakout session, just go in and give your opinion of it. And again, we read those. So we modify this conference based on your input, okay? So I'm going to show you a video now of how to use Slido. Maybe.
Slido is an easy-to-use web app, giving a voice to your entire audience. People can ask their questions without hesitation and vote on their favorite ones. And you can make the audience part of the story with live polls. To join in, participants can simply type slido.com into their web browser and then enter the event code. Works on any device, no need to install anything, and your event just gets rolling.
Great. All right, so we're gonna test it out. So everybody go to slido.com. Okay. And you are going to enter the first thing that comes up. It's kind of a pound sign, and you're going to put in the FSS2019. It's on the bottom here. Then it's also going to ask you, the next thing is, what room are you in? You're going to put azalea. So you're going to select the azalea room. Okay? So I'm going to give you a few minutes to do that. As you start, when you go to the next one, I want you to take the poll. There's only 2 questions, very simple, very quick. And you're going to interactively see the results of those polls. Say it again. Wi-Fi password. I don't know. There's no Wi-Fi password? Okay. There's no Wi-Fi password, but we'll see if we can do that later. So if you're able to get to it, go ahead and slido.com. Looks like we're doing pretty good with parking. And then what was the other question, Jennifer? How long has your establishment been open? So more than 10 years. So this is kind of interesting. This is a good question for us to tailor who we bring to present. Okay, so what does our audience look like? That's awesome. So this is what you'll be using throughout the breakout sessions. Okay, very easy to use. A lot of people don't like to get on a microphone and talk. So simply just ask your question there, and then they'll address that as the breakout session goes along. Okay, so lunch will be served back here at 12:15, okay, after your 2 breakout sessions. And also, where are my investigators at the table? Blue shirts, stand up. So at lunch, every one of my investigators are going to be sitting around all these tables, okay? And I want you to take the opportunity to ask them questions. Okay, again, we're here to educate. If you have questions, ask them. If they don't know, they're going to find out the answer, and they're going to be sure to get back with you that answer. Right? Please be sure to visit our vendors. A lot of you saw the vendors outside. And now we're going to move on to the panel discussion. So I'm going to bring up Dee Marlowe, and she is going to start our panel discussion.
Thank you, Michael, and good morning, and welcome to Food Safety Summit. It's great to have you all here with us today. And we're going to talk a little bit about social media today. Just quickly, by show of hands, how many of you have to deal with whether a Yelp review or a Google review, or do you have an Instagram account? Okay, I have some. Facebook page? Okay, perfect. Okay, so this will be really interesting for all of you here today. So just really quickly, we all know that social media is without a doubt the most popular online activities people do. So at any given time, there's about 3.2 billion active users on social media right now. So all of you, just raise your hands, you're one of the 3.2 billion. So what does that mean? So about 70% of the 3.2 billion people have said that they will share their experience. So whether it's out with their service or a company, they will share that experience online. So whether it's through a review or through making comments, and they'll tell everyone and their friends and family about their experience. So what does that mean for you and for the food industry? That means customers now will make decisions based on the information they gather from social media. And people who are on social media will be really easily to tell you, all of you, and their friends and family about your company. So what does that mean for a lot of the business? A bad review or bad experience that is shared online or retweeted can really teeter your company's reputation and shake up consumer confidence. So what we're here trying to do today is to kind of talk about how we can utilize social media in a way that is both going to promote your business, but help us reduce foodborne illness and health risks, and how can we create a risk management plan that is best fit for your business going on. And also, how can we prepare for the future? We'll try to answer some of those questions here today. But first, let me introduce you to our panelists. Here next to me, we have Juan Arellano. He is the executive chef and corporate officer at Lorenzo's Group, and they are the founders of the highly successful El Tiempo, I'm sure all of you have heard of. And I have Jory Lange. Some of you might be familiar. He's backed by popular demand. He was our speaker from last year. He's a food safety attorney at the Lange Law Firm. And next we have Adam Miller. He is the president and CEO at Aegis Insurance and Financial Services. And last but not least, we have Patrick Quaid. He is the founder of DineSafe.org and also IWasPoisoned.com. So before I get to our questions, I just want to remind everyone we have Slido open, so send us some questions. We have a couple questions we'll talk about, but I really would like to hear from all of you what questions you might have. These experts here can really give you some good recommendations. So my first question is, all of you here represent a really unique perspective of the food industry. So from your perspective, how has social media changed the way we do business, and how do you involve social media in your day-to-day life?
What's fast? Super fast.
Super fast.
But we adapt through these changing times, and what we've noticed that we had to develop a 3-tier program. We have a proactive, an active, and a not so much a reactive, but what we call a keeping our promise program. When we get such a positive review, with our keeping a promise, we send our team, go to the unit, and we'll make sure that everything was done in order for us to ensure that we didn't put any ill will to that guest. And I think that's what what everybody wants to make sure it happens. So our proactive program is we do have a health and hygiene team that goes into every single unit on a daily basis without announcement and spot check every single detail. Even if it's when food's being delivered, so the cold chain doesn't get broken, or if it's wearing gloves at all times 100%, no matter if you're just on the grill or so on. And in our active team that we have, it's just with our managers. Those are our core group. And we've been really, really blessed to have such a long-term, staff that they are embedded into this culture now. And then with our Keeping Our Promise program, that involves me, the owner, his son. Where we go and engage with the guests. We ensure that if we did do something that was not up to par, that we take full responsibility to ensure it doesn't occur again.
Interesting. So you already have a process in place.
Absolutely.
We'll get to the process. I'm sure a lot of you might want to know some recommendations. So Jory, what do you think?
Yeah, so I think that our whole economy is based on trust. And as businesses, when we sell a product or service, we trust that the consumer is going to pay us for that. And then as consumers, when we buy a product, we trust that it's going to be what we're told it was and that it's safe. As a lawyer, where I come into all of this is in big food poisoning outbreaks. And that is an obvious problem for the trust in a restaurant or a food product. And what I've observed is how the restaurant handles social media, how it interacts with its customers during the outbreak has a dramatic impact on that restaurant's long-term brand. And I think what I've observed is that the most important thing for a restaurant in a food poisoning outbreak that finds itself in a food poisoning outbreak where none of us ever want to be is to focus on that long-term brand. And so 2 quick stories about different food poisoning outbreaks that I've seen in the last 2 or 3 years. One was, and they're both really similar outbreaks. Both involved small restaurants, one in Colorado, one in Boston. The one in Colorado was a small salmonella outbreak. They really had no social media engagement at all. They really didn't get their story out there during the outbreak. So outbreak happens, restaurant gets shut down, health department comes in, they clean up the restaurant, they reopen, restaurant shuts down 2 weeks later, never reopens, and that restaurant's just gone. So that was one approach. Another approach was another outbreak in Boston, where it was a company that had both brick and mortar stores and mobile food trucks. They already had a social media presence because they'd been using it to engage with customers, build their brand, and they were so smart, I thought. Their CEO in the middle of the outbreak came out. He did a video that they put on their social media that all their customers are now seeing, and they took responsibility for what was going on. They said that the customer safety is our first and most important thing, and that's a big deal because the best thing you can do during an outbreak is let your customers know that you're going to put their interests first ahead of your own interests, and in the long run, those customers will come back to you, and they will return that loyalty if you do that. So this restaurant that was very proactive, very engaged, got its story out there, they're doing fine. They had a blip with the outbreak. They haven't had the problem again. Another thing they did a great job of saying is, we're going to voluntarily close our restaurants while the health department comes in. We're working hand in hand with the health department to find the problem and get back on our feet. And that's something that's important to remember too. The health department, they want you guys to succeed. They want your customers to be safe. They want you to do well. They want to come in and help you fix the problem, get back on your feet, and get going. So that's just a quick story about 2 very different approaches, and they had a dramatically different impact on those restaurants' long-term brands.
Adam?
In my space, it's actually very interesting the last few years what's happened with insurance and risk management as it relates to restaurants and definitely foodborne illness. The carriers now have people on staff that all they do is monitor people's social media. We actually get feedback from carriers, hey, did you know this client does this client does that? And sometimes we have egg on our face because I can't monitor every single client out there. They're using the app that was promoted earlier today and looking at the food safety inspection reports that are happening. Everybody remembers back in the Marvin Zindler days that we'd all watch that. And I see, because I have so many restaurants I work with that I'm friends with the owners on social media, that I'll see the going back and forth of conversations and dialogue where somebody had a bad meal, they think it's foodborne illness, they're not sure, and it's amazing how rampant and how fast something can get out there. And I'll be the first one to say 9.9 times out of 10, it's not actually foodborne illness. Somebody just got sick, they coincidentally happened to be eating out at a restaurant, they don't even remember which restaurant it was. They don't have the timeline to it. Nobody else got sick. I can't tell you the last time I knew of a foodborne illness at a restaurant that was only one person got sick. It's one thing when 30 people get sick, but one person, more people are likely to food poison themselves eating at home in their own kitchen than they are when they go to a restaurant run by people like the Lorenzos. I've been in almost every one of their kitchens. I guarantee most of y'all's homes' kitchens are not as sanitarily cleaned as theirs is. And that's the message I try to promote to people, is understand that you've got to take social media for what it is. And don't let it replace the jobs that all these people in blue shirts here are wearing. They need their livelihood. Keep that in mind.
So social media has exploded in the last 10 years. We all know it. Most of you will have some kind of social media platform, whether it's Facebook or Instagram, that you use. And it's especially true in the younger generation. And what we do is kind of an extension of that within the food safety space, which is allowing people to speak up. And the learning that we have is that people really want to speak up about food safety. We're seeing people do it more and more often. It's in the news a lot more. And I think the learning we have is that, as we see our site grow, is that the message is that it's something that you can't ignore. It's not, our message is social media is not right every time, to your point. And we're not saying you have to like it or that you have to post on it, though we think having a presence is a great idea. But our main message is do not ignore it. There are incredibly valuable signals in it, and it's growing fast. And our focus is really trying to manage our platform responsibly and make it available so that we can partner with restaurants or businesses or groceries or food chains or anyone in industry who wants to use the data to help create better outcomes.
So Poison.com was founded in 2009, and right now you guys, I think, have over 45 subscribers in the United States, including some countries outside the States as well as subscribers. So why do you think there is such a need or a demand for those type of information?
Yeah, so we're in 45 or 46 states, 6 countries. We cover 93% of the United States by population in terms of public health subscription, and thousands of businesses and thousands of consumers. So why? So from a consumer's perspective, reporting online, it's real time, it's accessible, it's transparent, it feels democratic, it's intuitive to report online on social media. And that's why we see consumers turning to that as a way to speak out versus traditional methods like a county hotline or stuff like that. So for the public health, that's because public health and environmental health need data to help keep their communities safer. More and more people report with us for a variety of reasons, so they want that data to help protect their communities and also help educate their restaurants. Industry wants it because they're in exactly the same boat. Every single one of you here is, or most of you are representing restaurants, and you care about food safety. You are here. It's top of mind. Now, is it right every time? No, it's not right every time. Especially if it's a single report. If there are 100 reports, then that's something that's worth looking at, which is where we come into play, which is signals management. And companies want data, and they want to do better, and we're here to partner with them to help them do that. So they're the 3 reasons I think it's been popular.
And I think one thing that we can all agree on is that social media isn't going away anywhere. And I think people and customers really value that authenticity and transparency, and that's why it is so important for business to build a presence online on social media. So what are some of the advice or recommendations from your experience that we can give to our restaurants here when they are building their social media plan or their platform?
We have this great person that handles all our social media, and we found out that that's the way it works best for us. We have multiple people, lines seem to get crossed, but designate one person to really handle that. As soon as we get an alert, we talked about our system earlier, that seems to work for us. Obviously, each entity has its own, is going to create their own version of it, but communication is key, 100%, especially with this digital age, like you mentioned, it's not going to go away. And it's only going to get faster and faster and faster. The quicker you get to the alert, have your system in place and execute. That's the best thing you can do.
And Jory, from your perspective, when you're dealing with these cases, what are some of the advice you keep giving our businesses?
I think that when you get a review that's not what you want, when you get a bad review, the most important thing is to respond quickly to that. And to realize that there's even an opportunity in there, because I think everyone realizes that there are going to be people who say something bad about anyone, but how you respond to that, and if you respond in a thoughtful, sincere manner that shows that you care about your customers, that's going to help you. So I would make sure to respond. Don't ignore the bad reviews. Don't let them sit there and fester. Try to respond to those.
I think they've already nailed it on the head. The response is important. Make sure it's a public response. Sometimes you need to take things offline. Sometimes you find out a disgruntled former employee or a competitor, but that's rare and rare these days. But make sure that you are very public about the fact that you're taking a proactive action And the hope to get that person to go back and say, oh, I went to such and such restaurant, and they've now fixed the issue, or they've made things right. They've invited me back in for a complimentary meal, and it was a much better experience. And you basically need to wine and dine your clientele.
Yeah, I agree with all the comments. The other comment I'd make is that some people think, oh, well, a bad review will destroy my business. I'd say chill out on that idea. Like, you know, probably most of us have used Amazon. Even the greatest product in the world on Amazon has a 1-star review. The Grand Canyon has 1-star reviews. You could actually look it up on Yelp. I'm not kidding. So with people speaking up online, especially younger generations, they're much more inclined to speak up online, but they're also much more wary of like one-off reports that don't necessarily mean as much. They know because they did them themselves. So they kind of look at, you know, and even ourselves, we look at reviews like how many reviews, you know, like not treating a single review as truth, which we don't. And I think that's just something to overlay on top of that. Like, it's okay to, you know, to respond. That one review won't hurt you. Hiding from it or running away from it can hurt you. And like one of the things we say is treat every customer like they have 1 million Twitter followers.
And that's really important, just to be transparent and respond to. So I do want to take this opportunity to see there's some questions from Slido, and people might have some questions from the audience. We'll pull up the Slido questions. So I think one thing the audience might have is, so what if I'm not a global or a national chain? Can I still do a plan, prepare for the future, and build a presence with my limited staffing or budget for the mom and pops out here?
Well, there's so many ways that we do on our own, and you know, one of the things that the owner for the restaurant always emphasize on us is always be personable, always be genuine, and make sure that, you know, that person or anyone gets taken care of. So in a bigger platform, I think, you know, not necessarily you lose the personality. I mean the one-on-one person, but you know, sometimes I guess people feel like they don't have a voice on that.
Mm-hmm. And Patrick, did you have something?
Yeah, I say absolutely get involved with social media. You know, for some of you, like, I don't know if anyone's had to deal with, like, for example, Facebook Ad Manager or Facebook. Some of these platforms are just complicated. They're literally, it's not easy. But I say, or we say, make a start. If you have to get someone in to help you, because to your point, it's not going away. You know, so get on with it. You might kind of struggle technically with some of the platforms, and it might take a while to find your stride and to find your voice, find what you want to say, and how you want to say it, where you want to be engaged. But sitting on the sidelines is a non-option when it comes to social media.
Yeah, and to pick up on something you were saying, Juan was saying, being real and being genuine, you know, I think we live in such a digital age. We've got so much information coming from us. And at the same time, we're kind of starved for human connection. And I think that showing care, showing concern, being yourself, which you can do in social media, can help a small restaurant in particularly. I think that in particular for small restaurants that don't have a big marketing budget, Facebook's free. You know, Yelp is free. You know, you can get on these things, and while they may be a little intimidating to begin with, remember that the greatest people on Facebook right now are 15 and 16-year-olds, you know? And if they can figure it out, you can figure it out. And if not, your kids can, and they can help you.
Yeah. And I think this is a great question. How liable as a restaurant owner am I if someone does get sick or claims to get sick at my establishment?
I think that's me. So in most states, this is the way it works. As a restaurant, you are considered a manufacturer, which means you are strictly liable for the quality of the products that you sell. If you sell a product and it gets someone sick, and it can be proved that it got someone sick, you are responsible, even if we can't show that you were negligent, which is what the law is. And the idea behind that is the law has taken the approach that we're going to put the risk on the person selling the product for profit. So that's why it's so important we've been hearing about the linemen and the offense. That's why it's so important to do everything you can to prevent getting someone sick in the first place.
And Adam?
You actually said it pretty spot on. It's something I deal with almost on a daily basis, and it's not even just a foodborne illness. It's somebody claims they chipped a tooth. My favorite claim I've seen so far was a seafood restaurant that somebody claimed there was rubber band in their calamari. And I asked if it was the first time they've ever eaten calamari because it tastes like a rubber band. It's just some of the crazy things I see. We had an epidemic at a restaurant out in Katy, I won't say their name in case their owner's here, that 3 different elderly people, and no offense to the elderly, claimed in a 5-day window of time that they chipped or broke a tooth eating seeded bread at this restaurant. And they all wanted to file claims, and they all happened to somehow coincidentally seem to know each other. And it just is weird stuff that you see out there. And I mean, if I could just publish without getting in trouble the claims that I see come in around restaurants, it would probably scare most people in this room out of business and prevent anyone else from wanting to get in it. Consumers as a whole think that every restaurant owner is rich. And they think that y'all make it so easy and that y'all are just charging ridiculous prices for your food and this, that, and the misconceptions out there that are insane. And it makes people want to get something for free. And that's why I preach to my restaurant clients, never ever take liability and responsibility up front, and never ever give away free food or a gift card. Deal with it after the fact. I know that a lot of people in the room are probably gasping that I'm saying this, but I'm saying the minute you do that, you've taken full liability. There needs to be a thorough investigation. What actually took place? Was this somebody that slipped and fell after they ate a $150 meal and is looking to get it for free? It's amazing the amount of slip and falls I see in areas of restaurants where there's no camera and there's no wet spot. You'd be surprised how many of those I see. And what my clients enjoy about me is that I'm a fighter. I will actually go and investigate the individual claims when something just seems out of character. I've had clients that have had the weirdest things happen that couldn't possibly happen, and that's also why I preach lots of cameras. When you're building a restaurant or remodeling, and he's shaking his head, I can see it at the corner of my eye, because they're famous for it. And I can tell you, I've dealt with many of their very large claims as clients of mine, and I have fought tooth and nail for them. And they do one of the best jobs in the industry of having safety programs in place and cameras everywhere. I know their whole entire leadership team, they're phenomenal, and they are the poster children out there for ways to protect your empire. And I hope that every one of y'all someday have an empire the size of theirs to be protected.
So if all of those claims go to iwaspoisoned.com, how do you have a way to filter and sort of maintain that integrity of that data that you do receive?
Yeah, so we have, every review goes into a queue to be moderated. Every review gets both a technical back-end review looking at IP address, timestamp, validations, and then it gets a human review where it gets read. So the goal of that is to eliminate inauthentic and malicious reports. And our promise is, to the best degree possible, we believe it's a real person who believes they have foodborne illness, which doesn't make it so, but it's a process to make sure the data is of the highest quality possible. And then from there, we're looking for signals. Now, we don't ever claim that a restaurant gave someone food poisoning. It's not what we do. We're essentially a data agent. So we collect data and we get the data to people like public health agencies or restaurants that are interested in looking at it. Now, a really curious note, which is a little bit counter to and maybe that's a different crowd that would come to you guys versus us. Most of our reports don't go live on the website. So when people report, they have an option to report privately, to not show the report on the website. So the majority of people don't want to put it on the website. They want to report it. They want the restaurant to know, public health agency to know, so they can look at it and see if something's going on. But they don't want it to show live on the website. And the number one reason given, they don't want to hurt the restaurant. So there's kind of like a really huge self-cleansing aspect to what we do, where what we see is the people who are speaking up are largely not out. I think I've never had someone ask about how do I sue, maybe twice ever out of an enormous number of reports. It's just not It's not a huge thing that we see. Obviously it happens, but it's not something we see. We do the best we can to, it's a huge priority is moderation, and data quality.
So that's interesting with all of, I think earlier on there was another question about predicting sort of future foodborne illnesses with all of the data that we can collect so far. So is there a model or a system that you can sort of predict?
Yes, so we have really powerful signals that point to certain businesses. So certain, and actually in the talk later, I don't mind talking about it because it's pretty public with, but an example is with Chipotle, which we detected their first outbreak and many of their, most of the rest of their outbreaks. We could tell before their first outbreak in August 2015 that they had a systemic food safety problem through our data. The rate of reporting for their brand was 10 to 15 times higher than our benchmark, consistently, week in, week out. And this was before their first outbreak when they were still considered, they were considered a very health forward and whatnot. So yes, we can see where a whole chain is really like at an elevated risk based on consumer reporting, or is doing very well in the inverse. And we can also see stores that show up repeatedly. Now, again, we don't say, oh, well, this is, we consistently see reports from this location, therefore there's something wrong there. What we say is we consistently see reports, someone ought to take a look at it. Now, it may be the water supply, it may be other environmental factors, but we're getting data to people so they can say, okay, why does this one region or one store have like a huge volume, is this a risk for our business? Is this a risk for our brand reputation? Let's take a look at it and make it, help it get the performance of our other stores. So that's how we think about it. So the short answer is yes, ton of interesting stuff in there.
So from hearing that, in your experience, what would you recommend businesses to consider? What are some of the key factors when they're building their crisis management or crisis response plan?
Again, we use a 3-tier factor, or levels. And what I always recommend is to really heighten everything. What I mean about that is that, in Houston you have different cultures coming in to work into the workforce, okay? And then they'll do the slapstick, oh yeah, it's okay, no problem. What I emphasize a lot to our executives is, or the executive team that goes into these restaurants, is that it's law, okay? You preach that it's law. You preach it to the highest level. Not to the point scaring them, but to the point that they really understand. Because when you're in the movement action phase of the lunch rush and dinner rush, sometimes things get out of hand. So what we tell our staff is, it's law. You got to do it. It's black and white. Treat it like the Bible. Treat it, as much as you can, to the point that you're serving your mother, your son, your child, or so on. So that's one thing. Then with our 3-tier program, which is having our health and hygiene people go into each restaurant, that reinforces that. The ownership reinforces that 100%. Having the active, personnel in there, enforcing that as much as possible. Then, if something does go off, sideways, we have our reactive, team to respond, which, like I said, it includes the owner, his son and myself and a couple other executives. But the key thing I want to go back to it is that we tell them it's law, okay? And the last thing you want to see is, someone just getting really sick for not following those steps.
Adam was saying earlier, don't give out free meals. Don't do things that would essentially admit liability. And I think that's good advice for a restaurant owner. I think it's important to note, though, there's a way that you can, when you get a complaint, there's a way that you can validate the customer's feelings. You can say, I'm so sorry that you had a bad experience. this is what we try to do to make sure everyone has a good experience. There's a way you can validate your customers' feelings without validating the facts or admitting liability, you know? And there's a way you can actually turn that to your advantage and say, we're so sorry you had a bad experience. Here are all the things we do to try to prevent that. And everyone else who's reading that review then is going to think, God, these guys really care. They're really trying to do a good job. So that would be my advice.
I'll just add to that. When businesses are on our platform who sign up and use our platform to reach out to consumers, they're delighted to hear that from head office. I mean, they're literally, so sorry to hear what happened. We care a great deal about food safety. We'd love to learn more. They're literally beside themselves. It's a no-brainer. I couldn't agree with that more. It gets an incredible reaction.
I think people want to feel heard,
That's mostly what they want, yeah. Like almost 99% of the time, yeah.
Well, one of the things that I didn't mention earlier that I think is where I see a lot of potential claims come, especially that we're a coastal market. Seafood's very hot here, and sometimes not foodborne illness directly due to bad product. There's a lot of cross-contamination that could potentially happen in kitchens. So the one thing I preach to my clients is for clarity and transparency to always ask every diner at every table, do you have any food allergies? Because they may not realize it's something they had no interest in ordering. Like, perfect example, at an El Tiempo, I go there and get fajitas, but what if I have a seafood allergy? I need to make sure that they know that, regardless of the fact that I know not to order shellfish. And so that's something that I preach, and I know that I've coached them on this, and that's why it now says across the bottom of all their menus the disclaimer that they do have raw shellfish and seafood in their kitchen, and their staff has now been trained to ask at every table of every meal at every one of their units about any foodborne illnesses or not foodborne illness, about any allergies that any of the patrons may have, so they can report that back to the kitchen and make sure that there's nothing that's going to hurt those patrons.
And just to bring it back to our future theme, just quickly to summarize, what do you think, because social media platforms are constantly evolving, where do you see the future hold for dealing with food safety issues or customers via social media?
Just be transparent, like, everybody, keeps, saying, just tell them, what you do and so on. Our newest kitchen right now is an open kitchen. You walk in through the hostess stand, see through the whole line. We're not hiding anything. We want you to see that we're trying to be as safe as possible, healthy as possible, and ensure that our staff, is working side by side with, the health department to ensure that everything goes, the way it's supposed to go.
I can't say it any better than Juan. I think that's perfect.
Thank you.
Every day, check your social media, check all your different outlets. I think they have a great model of having a dedicated person doing it. I think that's a really good message. A lot of restaurant concepts, especially as they grow out of control, and they think it's better to have one person at each different unit. I 100% agree that needs to be a central voice that is consistent in the message of how you speak to the public. It's the same thing you do in your marketing. You don't let each of your restaurants have their own marketing budget and their own marketing tools. Social media and your response to what goes on with reviews is part of your marketing plan, and treat it accordingly.
Yeah, second all that, and just, it's not going away, to your point. It's growing fast. People are more engaged than ever, so don't ignore it. Get involved, and it's a tool you can use to your advantage overall.
Thank you guys so much. This has been really great. Round of applause for our panelists. Thank you for being with us. I think that's all the time we have. I think we're going to...
Pleasure.
Good to meet you.
Thank you.
I'm going to have you guys stay up there. Deanna, where'd she go? We got some certificates we'd like to hand to you, and some nice going away gifts for you. Again, can you guys give these guys a round of applause? I thought it was excellent. I certainly hope you got something out of this discussion. Thank you, gentlemen. Appreciate it. And somebody said up here that picture was for social media, right? Okay, so next thing, I want to take this time to, we're launching an accredited online and in-person food manager training in both English and Spanish. And we're also working to get Chinese and Vietnamese. So I was going to show you up on the screen. We actually just launched this yesterday. So you go out to our website, and then where's our website? There it is. That's our website. Inside there, you just type in food manager. And we have a delay. It's coming. Ah, there it is. And then once you select the food manager and food handler training, you get the next screen, and you can go on. So anyway, we're trying to make it easy as possible. There are a lot of options out there. We are merely one of them. When we go out to food establishments, we don't just share our classes. We have a list of classes that individuals can take, because obviously it's required. So moving on, the breakout sessions are going to be downstairs, on the 3rd floor. And before we do that, we're going to do a raffle. So you got a blue ticket. Everybody should have got a blue ticket. Where's my...
For our first raffle today, we have a gift basket donated from one of our vendors, Smart. You can see the rest of their display out in the hallway just outside these doors. Do you want to pick a number?
I'm going to have her read it because she can see it.
Okay, the number is 608-1548. The lights are really bright, so you're going to have to stand up. 608-1548.
148. Now, you all are here. We didn't get a chance to leave. Take a look at your ticket. Ah, really? Okay. We got it? We found it? All right, come on up. It's a long way up here. You're going to get some steps in. And thank you, Smart, for donating that. Okay, so again, we are going to be downstairs. We're going to meet back here after the 2 breakout sessions at 12:15. Oh yeah, and remember, put the hashtag FSS2019 so y'all can respond on Slido. On Twitter, sorry. Hashtag I'm being guided here. Hashtag FSS2019 on Twitter, but use Slido as well. Okay, we're done. We'll see you back in a little bit.